Time for our visit with Dr. Kevin Kavanagh, retired physician and also founder of Health Watch USA. Good morning, Doc.
Good morning, Jack.
I read this morning. I thought of you when I read this, so I saved it for you. The Centers for Disease Control have lifted its recommended 14-day quarantine for anyone who traveled out of the state or out of the country. The update came Friday. The CDC now says to follow local, state, and other recommendations after traveling. There is still a level of caution. The CDC warns you may have been exposed to COVID-19 on your travels. You may feel well, but you could be contagious without symptoms. The warning continues saying you and your travel companions, including children, pose a risk to your family, friends, and community for 14 days after you were exposed, and they still recommend a course of action, especially after returning from a trip. I believe, if I'm not mistaken, the EU, the European Union, is still banning travel from Americans to Europe. Is that right? Do you know?
Yes, and so is Canada. So it doesn't seem like that's going to have much of an impact. You know, what can I say? We're just now starting to decline out of this latest peak. And we saw what happened in June when we pulled back all of a sudden. The virus hasn't gone away. I think we still need to be very cautious and careful. And so I would not recommend pulling back on a lot of these public health strategies. That doesn't mean closing down the economy. It just means let's be smart. If you go to an area that still has a high rate of viral spread, which unfortunately Kentucky is one of those, I really think that we still need to use common sense. And if you come back to your home, don't go contaminating other people or your family or your friends.
Tell us about Pfizer changing the vaccine they were testing.
Well, this was kind of surprising. Pfizer jumped from doing the initial vaccine, and if you remember many months ago, I talked about how I thought the rates of fever, 75% of patients, although maybe safe, isn't going to be one that's going to get people to really go out and adopt it. Because if you have to go into the urgent treatment center, it's unlikely you're going to get a high percentage of the population to take the vaccine. So they've now are running their trials on a different version of their vaccine. One of the things you can look at, and I know this is kind of peculiar to say this, but if you look at their stock price, it really tells you what the insiders think of the efficacy of the vaccine. And so that's just a little tidbit on all these companies that are coming out. And if you hear, for example, Remdesivir, that's a miracle cure, well, it's not. From this information coming out that I'm seeing, it will probably help some, but it's not going to be a huge game changer. And if you look at the stock price, it's not shooting out through the roof that they've invented the cure for this pandemic. And so I think that that's something to really take note of.
What else do we need to know about this morning?
Well, I think that really our program has been on target. What we went over on Friday morning was pretty much echoed by the governor on his Monday news briefing. It was stressed by Dr. Stack about the myocarditis in the children and the athletes, the prolongation of the seasons for the Big Ten and Pac-8. All of that really came out. And also when we talked about Monday, how Serum is probably good, beneficial, but it's not a game changer. This was also, well, we were also verified on that because yesterday the FDA walked back their glowing statements of how this was going to be a game changer. As I said before, Serum to me looks like it may help some. It's been given to over 30,000 people, but to get maximum benefit, if you have to give it right when you're diagnosed and with the high level of antibody serum, that's kind of like rabies. You'd have to give it to everybody. And there's just not enough serum, not nearly enough. So I don't see it being a game changer. But to me, that's a good sign for the Eli Lilly product, which is going to be the manufactured high quality antibodies that they're coming out. Because there, you may be able to get a dose right when you get a positive test and ward off this disease. So game changer, no, but I think it does show hope for the future. Certainly, if I was sick with COVID-19, I'd want to get Serum and Remdesivir because even a modicum of benefit with this severe disease would be beneficial.
Dr. Kevin Kavanagh, thank you very much as always, and we will talk to you again on Friday.
Thank you, Jack.